in the in the house to look after and care for the patient, and patient is not having any risk to himself or to anyone else, then it could be a possibility with close monitoring to do the treatment from home. But by and large, when schizophrenia appears, it appears suddenly with acute symptoms. The symptoms which are dramatic, which are very distressing. If the medical team or the physician has advised that patient needs to be hospitalized, that advice depends upon his expertise, his experience, and his knowledge about what can happen and how to really treat that patient. Sometimes we have to use the provisions of Mental Health Act for admitting the patients involuntarily. It's only done for a brief period of time where patients are not willing to stay in the hospital, and it is extremely important that they stay in the hospital and take treatment. After a period of hospitalization as an involuntary patient, the same patient can stay as a voluntary patient once he improves and understands the risk and complication and gives the consent.
Initially, involuntary status can be very upsetting for individuals that come into the hospital. They don't understand often what it means or why they need to be kept on an involuntary status. But they do have options when they are made involuntary, which we'll talk about in a little bit. But it is often important for us to make somebody involuntary to help protect them and to make sure that they're going to be safe. And it's important to have the family to support us in those decisions and to help us explain to the person why we have to do this for their own benefit at times.
The role of the family and caregivers is varied and critical, especially when the patient is hospitalized. Your loved one is going to need a great deal of support. They're going to need your concern. They're going to need you to be an advocate, and they're going to need you to be there for them. And then again, after discharge, the continued care, support, advocacy must be continued in the community. It's difficult for anyone to succeed once they are discharged from the hospital unless they have that care and support.
The major question that we get from families is, what do they do when they care about somebody and they know that they need to be hospitalized, but that person doesn't think that they need to be hospitalized? That's a huge issue for a lot of people, because often people who are suffering from mental illness don't realize that there's anything wrong. What they think is happening is that everybody else has the problem and not them. So it's pretty hard to convince them to come to hospital or get treatment. So there are options for people when there is this situation. There's not a lot of great options, but there are options to help get somebody into hospital when they don't want to come. There is the justice of the peace, which someone can go to if you have evidence that you've collected based on things that you've seen the person do, activities that you think are bizarre, statements that suggest a risk to themselves or others, or if they're not caring for themselves. That you can go and present this information and try to get a person brought into hospital for an assessment even if they don't want to go. Unfortunately, a lot of times people have to end up calling the police to come out and do an assessment from wherever the person is living. The police are the only people under the Mental Health Act who are able to come out and do an assessment with somebody and take them to hospital against their will. This is a very distressing situation for families because they have to call 911, they have to have the police come out, and their loved ones often think that they've betrayed them and are very hurt and angry with them for a long period of time. We hope, though, when they recover that they do see why this had to be done. There's also things like community treatment orders for when somebody is in hospital and they're leaving, and we're not sure if they're going to continue with the follow-up. They're doing well, but they have a history of not always doing well after they leave the hospital. The community treatment order allows us to make sure that they are getting follow-up, and if they don't, it puts some precautions in there to make sure that they would be brought back to hospital for an assessment if there were further concerns. So it can be a good option, but again, it can sometimes feel very restrictive for certain individuals that we're talking to them about it.
All of these are effective ways to help to get your loved one to the hospital when they would rather not